Ever wondered, what is abscesso periradicular agudo and why should you know about it? Well, let's dive right in. First off, let's look at the causes and formation of abscesso periradicular acute. It's essentially an inflammatory response to bacterial aggression in the periradicular tissues. Virulent bacteria can lead to purulent inflammation. Enzymes and oxygenated radicals promote tissue liquefaction, thus resulting in pus. Moving on to the histopathological characteristics, we find an intense reaction near the apical foramen. This is accompanied by the presence of purulent exudate or pus. The inflammatory infiltrate is rich in neutrophils and periodontal fibers may be torn due to edema. Now, how do we diagnose abscesso periradicular agudo? The signs and symptoms include spontaneous, throbbing, and stabbing pain. Systemic involvement such as lymphadenitis, fever, and malaise may also be present. There's a dramatic relief of pain after the periosteum ruptures. On inspection, intra- or extraoral swelling may be visible depending on the stage. Tooth mobility and extrusion may also be present. Pulp tests generally yield negative results due to pulp necrosis. Heat and electric tests may provide false results. Periradicular tests like percussion can give positive results but should be done with caution. Palpation is generally positive. Radiographic findings can reveal periradicular bone destruction in acute cases. There may be thickening of the apical periodontal ligament. Presence of extensive caries or deep restorations can also be detected. Treatment of abscesso periradicular agudo involves immediate drainage and elimination of the aggressive agent. The root canal needs to be cleaned and disinfected. This is followed by intracanal medication and canal obturation. Analgesics or anti-inflammatory drugs are prescribed and antibiotics are used in special cases. Finally, the dissemination pathways depend on the anatomical relationship of the dental apex. Dissemination to anatomical spaces can result in severe complications. So, in a nutshell, abscesso periradicular agudo is an acute dental condition caused by bacterial aggression. It's marked by intense pain and inflammation. Diagnosis involves physical inspection, pulp and periradicular tests, and radiographic findings. Treatment involves immediate drainage, cleaning and disinfection of the root canal, medication, and sometimes antibiotics. Understanding the dissemination pathways is crucial to prevent severe complications. So isn't it fascinating how something as small as a tooth can be the site of such complex processes? The more we know, the better we can manage and treat these conditions. Remember, knowledge is power.